to expand healthcare capacity and to keep our communities safe and strong. Now, I know that everyone shares my concerns about public health and safety and about the economic recovery. We look forward to working with stakeholders and our partners in the legislature to get things done as soon as possible. Thank you so much, and I'll now turn this over to DHS Secretary Andrea Palm.
Thanks, Governor, and thanks again to everyone for joining us today. So I'll start where I always do. Here are our numbers for today. 15,856 negative tests, 1,221 positive results, and we now have 14 deaths in the state of Wisconsin. The positive tests that's 109 more than we were at yesterday, and obviously that is an increase of one death over yesterday. That was of a male in his 40s. You can find these numbers as well as the county breakouts of this data on the DHS Outbreaks and Investigations webpage. Now I want to take you back to just about a month ago when Wisconsin had fewer than a handful of confirmed cases, and our state lab had finally received the test kits they needed from CDC to begin running COVID-19 tests here in the state of Wisconsin. They were quickly joined by the Milwaukee Health Department and have ramped up over the past month to a combined throughput of about 500 tests per day. In addition, a network of labs across the state scaled up, averaging 1,500 tests per day. And while there is no backlog of tests, we have prioritized healthcare and long-term care workers, hospitalized patients, and those at risk of the most severe disease from COVID-19, while continuing to work to expand our testing capacity so we are in the best position to respond to this evolving pandemic. To that end, we stood up a strike team as part of our statewide response that includes additional labs and industry leaders in both the private and public sectors. Just like during H1N1, we knew that testing for this virus would require assets beyond the state lab, and for this response, that has taken the form of a strong partnership between government and some of the best and brightest minds in business and technology. Lucky for us that we didn't have to look very far to find them. Our lab capacity strike team has welcomed the expertise and insight of leaders from Epic Systems, the Wisconsin State Lab of Hygiene, and numerous other state agencies to share resources, equipment, and knowledge to remove barriers and enable us to add to this next layer of capacity, which, as we announced earlier today, will initially double our lab testing capacity. These additional partners, all Wisconsin-based, include Exact Sciences, Promega, UW Health, and Marshfield Clinic. These companies are pulling together and stepping up to provide operational and resource support to one another to bolster our state's testing capacity. But I want to be clear, testing will still require a doctor's order, and these partners are not testing sites themselves. They will be receiving and processing the tests that are completed by healthcare providers. So while this is a critical step forward, it is important to remember something we have talked about a number of times before, that the supply chain for testing materials is extremely fragile due to this worldwide pandemic, much like the way the governor talked about the PPE challenges we're facing. So our new lab partners and our public labs will continue to be limited by access to the materials from their national suppliers and the federal government to complete these tests. And to that end, you remain a critical partner. We all need to continue to do our part to remain safer at home. Please continue your good hygiene practices. Continue to wash your hands often with soap and water. Cover your coughs and your sneezes. And when you leave home for your once-a-week grocery and pharmacy run, please exercise strict physical distancing. Stay at least 6 feet from each other. The more we all pull together while keeping our 6 feet physical distance, the better it is for all of us, and especially those on the front lines of our healthcare system, tending to our most severely ill friends and neighbors.
Thank you. We'll now open it to questions. A reminder to maintain audio quality, to please keep your phones on mute until it's time to ask your question. And for the sake of time, we'll also remind you that we are taking one question per reporter per outlet. So we'll begin the questioning today with Will Cushman from WisContext. Will?
Hi, thank you for the call. My question is for Secretary Designee Palm. You just mentioned that you hope that this new task force will initially double lab capacity, so would that equal about 3,000 tests per day, and will that be pretty much immediate? And what is your eventual goal for number of daily tests?
So yes, we do anticipate as a daily number that we will double what we've had previously, which is about 2,000 tests a day. I think all of our partners continue to try to expand their capacity, and new labs continue to try to come online. But as we have talked about, the rate limiting factor here, beyond bricks and mortar and equipment, is these reagents and ingredients that are necessary to run the tests. And so we all are very closely watching and working together to get our hands on the ingredients that we need to run these tests. But that ultimately really is what will limit our ability to continue to scale up. And so we'll keep you updated daily on our capacity.
Thank you, Will. Now to Sean Kirkby from Wisconsin Health News. Sean?
Hi, thanks for taking my question. On Friday, DOH said that the state was nearing or in talks to purchase 10,000 ventilators. Can you guys provide any more detail on who that is being purchased from, what's involved with that kind of deal, and where it is on the timeline? Thank you.
So we have made a request to FEMA for ventilators out of the Strategic National Stockpile, and continue to pursue private vendors to make purchases of ventilators. You know, we need to vet those companies. We need to make sure that they are legitimate and can supply what they say that they can deliver. And so we are actively pursuing a private sector vendor to place additional orders.
And just to be clear, this isn't the first time we've sought ventilators. We've been working with other states and trying to make a purchase. Those purchases fell through because we were competing with others. But I just have to make it very clear, we have been attempting to buy ventilators all along during this process. We believe we're at a point now where we will have some success.
Thank you, Sean. To Scott Bauer now from Associated Press. Scott?
Hi, thanks for this call. There's been a lot of talk at the federal level about a national peak hitting in about 2 weeks. Is there any estimate as to when Wisconsin cases are expected to hit their height, and how long after that high point do we expect the stay-at-home order to be loosened in some way?
Do you want to talk about the peak?
Sure. So there's been a wide range of modeling approaches, but from national and international groups, and they're all subject to the same limitations. Whereas meaning we can predict how the virus acts under normal circumstances because we know how long it takes for someone to get infected. We know how well it spreads from person to person. And so a lot of the worst case scenario modeling are reflective of those parameters in the setting where people are interacting as normal. So in those worst case scenario models, we're seeing the number of people infected double every 2 days. That was the early experience in Italy. That's unfortunately what we're starting to see in New York City, about a doubling time of 2 days. How long that really rapid exponential growth in the epidemic lasts is unclear, but it's really determined by how well we do social distancing and how we keep separation between people. So under the normal circumstances, the peak of about 2 weeks, with the largest number occurring there, is what most of the models say. Our hope, however, because the piece of the models that we have control over, meaning how well we keep separation between people, will actually cause a delay in the peak. So our goal is to stretch that out to the peak is lower we get to the peak at a lower time and earlier, so the total number of people or the area under the curve is smallest. So we're operating under that assumption that it might be 2 weeks, but we're really trying to enforce our social distancing to make that peak as low as possible.
Thank you, Scott. Now to Micah Selner from the Appleton Post-Crescent. Micah?
Hi. So across the state, you know of any lower tier patients being tested and categorizing those results in your statewide numbers?
Michael, was the question, do we know of any lower tier tests?
Any lower tier patients who are currently being tested, and are you using those results in the statewide numbers?
So our prioritization remains in place, so we continue to test healthcare workers, those hospitalized, those on the front lines in long-term care facilities. So I don't think that we are.
Yeah, we're not declining to test anyone for whom a physician or a provider thinks is important to be tested.
Fair,
and so we're what we mean by prioritization is that the quickest turnaround time, if we have to do them in order, is for hospitalized, critically ill patients and healthcare workers. But of the 1,100 cases that we've had, actually a minority are hospitalized at the time of diagnosis. So plenty of cases are being diagnosed in people who have mild symptoms, who come to urgent care or emergency department, and the healthcare provider orders a test. So we are prioritizing, but we're not restricting testing. Anyone who a clinician thinks needs a test can be tested within these parameters.
Thanks for that clarification.
Thank you, Micah. To Austin Montgomery from the Beloit Daily News. Austin? Beloit Daily News? Okay, we'll move on then to Sarah Thompson from WBAY in Green Bay. Sarah?
Good afternoon. I think this question would be for the governor. You mentioned in your opening remarks that we are headed into the worst of this and mentioned about setting up voluntary isolation centers. Could you just elaborate a little bit more on what those would be, where they would be, and kind of what they would look like for people?
Andrea?
Yeah. So we have been exploring setting up isolation facilities in a number of places around the state, as well as providing a toolkit and guidance to locals so they're able to establish their own isolation facilities when and if they need them. And the goal of these, as one of the priorities we have had throughout this response, is to ensure that there are safe places for folks who need to be isolated to reduce the spread of the disease, right? That is the point at which we are in this outbreak, is the physical distancing, the isolation necessary to stop the spread. And so what we've learned from our colleagues around the world and around the country is that an inability to have safe isolation places for folks minimizes your ability or reduces your ability to slow the spread. And so we are very actively working on a number of locations, and again, we'll be providing guidance to locals on how they can do that for themselves so that they regionally and locally have the capacity that they need to deal with this.
Thank you, Sarah. To Mark Leland from Fox 11 in Green Bay. Mark?
Hello. This might be going off this last question. I know, though, some state universities are working to potentially house COVID-19 patients. I was just wondering where that project was at, and do you anticipate having to use that for those sites anytime soon?
So I think, so isolation facilities for folks who are experiencing symptoms and need to spend their time isolated away from others, separate from potentially needing additional bed capacity, surge capacity, both of which are priorities for us and that we are actively planning for and working through the SEOC to ensure with our healthcare hospital partners around the state that we are ready to do both of those things, and we are actively looking at potential sites and facilities to do both of those activities.
Thanks, Mark. Now to Rob Sussman from WTIQ Radio. Rob?
Hi, thanks for taking my question. My question is about community spread. It's been something that was talked about very early on in this thing, and it seems we're not saying the words community spread quite as much. I noticed that there is no longer a point on the website in which you can kind of track the counties in which community spread has been identified. My question is, why is that the case, and especially here in Brown County? we were said to have community spread, but our case numbers have been ticking up kind of slowly. Can someone speak to what's going on regarding community spread?
Yeah, I can address that question. So the cases that we have identified through testing are known to be a very small subset of the actual cases. We think it's safe to assume that all communities in Wisconsin, if they don't have community spread now, are at high risk of having community spread. And so it doesn't serve the public to have different activities. We feel like because the way that people travel between communities and the high proportion of people who can transmit the virus with minimal symptoms, the safest approach is to assume that it is in our communities. And I think that the data from other countries and around the country support the fact that it's likely here in all communities, since we're just testing a subset of symptomatic individuals.
Thank you, Rob. To Addie Bink from WFRV in Green Bay. Addie?
Hi, thanks for taking my question. I was just wondering if you could explain a little bit more about how DHS reports their case numbers. For example, we see counties individually confirming cases, and those numbers will sometimes be higher or just different from what DHS reports in the afternoon. So if you could just explain that a little bit.
Sure. So we are on a cadence of updating once daily as sort of the statewide source of truth about the state of our case counts. And our local public health departments and our labs are reporting that information into us on different cadences. And so we at 12:30, we stop the clock, we count up what we've got, and we report it. And then as local public health feels the need to confirm additional things outside of that window, they do that, and then it will roll up for us into the next day's report. But we needed a way to be sure that we were on a daily basis updating the numbers and pushing them out in a way that people could know they were coming, could understand what they were, and then keep moving. And so we certainly would not discourage local public health from continuing to make information available as they feel that's important to do, but we roll that all up once a day and make it public at 2 o'clock.
Thank you, Addie. Now to John Neiser from NBC 26 in Green Bay. John?
Hi, good afternoon. Has there been any discussions with local paper companies here in Northeast Wisconsin about producing some PPE products that would make it so the state maybe doesn't have to compete with other states, but could then buy it off of local companies here?
I'll just mention that we're in the process of setting up a meeting, a virtual meeting with different paper companies. We're working through the Paper Council and to have that conversation. And it may be happening right now, but it's if it's not, it's in process.
Thank you, John. Now to David Wahlberg from the Wisconsin State Journal. David?
Yes, thank you. There was also quite a bit of talk yesterday nationally about the sort of worst case scenarios and better case scenarios in terms of cases and deaths. And last week, Secretary Palm, you provided an estimate, sort of a worst case scenario. If we didn't take strict measures in Wisconsin, we could have about 22,000 cases and 440 to 1,500 deaths by April 8th. I'm wondering, do you have any numbers based on models showing that we are taking strict measures? In other words, if we do things well, what might those numbers be April 8th and beyond?
Mm-hmm. So I do think, as we've discussed, from the time of infection till the time it shows up in our case counts, that there's a lag in that time, which is why we are continuing to see increases every day in our case counts, and I do think it'll be a couple of weeks before we start to really understand how well we all are doing social distancing, safer at home, to really judge ourselves against the worst case models. But you know, you can see our daily numbers as well as we can, but we really do believe that it's another 10 plus days before we are going to be able to start to see evidence of a flattening off of the new daily cases.
Thank you, David. Now to Parker Shore from the Cap Times. Parker? Parker Shore? And a reminder, *6 to unmute your phones. Okay, we're going to move on to Matt Cash from WKOW-TV in Madison. Matt?
Hi. My question is kind of a follow-up to a couple of questions ago, but we had a county in our area last week that had reported a couple of cases on Thursday, and then they were not reflected on the state website until Sunday. Can you just explain maybe the process in that? This was Richland County, if you want to give a specific location.
I honestly don't know the specifics of that particular number of cases, but we're happy to follow up with you directly and get somebody who can dig into the details with you.
Thank you, Matt. Now to Stephanie Fryer from News 3 in Madison. Stephanie. Stephanie from WISC.
Hi, this is Matt Clark, filling in for Stephanie. I've heard a lot of talk, and forgive me if this has already been brought up, but heard a lot of talk about different tests being available now that they're 45 minutes to get a result or 15 minutes, and I've heard, that it's going to be shipped. Is that being shipped to Wisconsin? Is that something we will be able to have here, and who will have access to that?
So, there are a variety of what the labs talk about as platforms for running these tests. And so some of them are higher speed, quicker throughput. Others are more traditional lab tests that have a number of steps and take many hours. And then obviously if the difference between a test that is done at the point of care in a particular provider's office, right? There's not transportation time for that test to have to get to a lab to be run and then back to the and then relayed back to the provider. And so there is certainly a range of time that it takes to run these tests, but some of it is about the platform that the particular test is being run on. And there are a variety of them in use in the state of Wisconsin, and they do have a variety of lengths of time from start to finish.
There's also been a proliferation of different kinds of tests that detect antibodies against the virus rather than the virus itself. In some ways that's advantageous because those are similar technology that are used in other places, but there's an important caution there, is that the tests that are done for diagnosis right now, which actually detect the virus, are highly reliable at saying whether someone is infected right now. Antibody tests, and there's been a lot in the news and a lot of advertisements about tests that detect antibodies, are not good for ruling out infections, because someone might develop an infection and the body doesn't develop antibodies between 5 and 7 days. So those tests, which are becoming more common online and in the media, can't be used in the acute setting to say that someone doesn't have it, which is really what we need in a lot of settings. So there needs to be some caution. Not all the new testing technologies are useful in the way that we need them right now. So we're still limited a little bit in these viral detection assays, which we really use to make diagnosis on an urgent basis.
Thank you. And to Tajma Hall now from NBC 15 in Madison. Tajma?
Thank you for taking my question. So right now we're sitting at least 14 deaths in Wisconsin. I'm wondering, is there any sort of correlation that we know of in terms of the age of these people, or even the timing between when they tested positive and when they passed away?
So Tajma, we did start to put age ranges for both cases and deaths on the website. I don't have that right in front of me, but I don't know, Dr. Westergaard, if you want to say anything about anything that the data is telling us about
There's really
this.
been a wide range, and with any time we have fewer than 20 cases of anything, it's really hard to draw conclusions. When we report the breakdown of age group, online with our deaths, you'll see that it's a pretty wide range. We've very, sadly had to report people in their 40s and 50s who have passed away, as well as people who are older. So right now there's a wide range, and too early to draw conclusions that it's affecting a certain age group more than others.
Thank you, Tajma. To Shali Pittman from WORT Radio in Madison. Shali?
Hi, yes, Dylan Brogan filling in for Shali. Governor, when would you like to see the legislature take up some bills in response to the crisis, and what can lawmakers do that the federal government, in addition to what the federal government is providing?
Well, I mentioned a few. One of them is that 1 week waiting for DWD, but we've asked all our agencies to take a look at what they believe they need, not necessarily number of people. Obviously, Department of Workforce Development needs more people, but what we can have in place at the state level that will help in recovery. So we have been briefing legislative offices all along on those issues, and hopefully we could get somebody to take the bait, frankly, and have us, let's have a legislative session so we can talk about it. Thus far, that hasn't happened. What we continue to work with the legislature to make them understand the needs that exist at the state level, to make sure that we serve the people in Wisconsin the best way possible. Waiting weeks and weeks, I don't think serves that purpose. But we will continue to brief legislators and their staff members, and hopefully we'll get there in the near future.
Thank you. Now to Robert Chappelle from Madison 365. Robert? Excuse me.
Hi, good afternoon. Thank you. There was some projections out of the University of Washington that now indicate that possibly we could be peaking here as late as April 26th, and that our case counts might actually exceed our intensive care unit capability. The governor mentioned the word field hospital. This is not something I don't think we've heard before. What kind of preparations are we making, particularly in Milwaukee, for possible overwhelming of ICUs, particularly?
Surge.
Yeah, surge. So it is one of our, it is one of the task teams that is a priority for us. We are working very closely with the healthcare system, with hospitals at the local and regional level as they assess their capacity, as they work together to figure out how they would share resources, what surge might need to look like in their local communities so that they are able to meet need. But I think to your point about the Washington model or other models that folks are looking at, our goal is to do social distancing, to do safer at home really well, so we don't exceed our healthcare capacity. But we, as the governor said, are hoping for the best and planning for the worst. And so these surge conversations are very actively happening now, and we are doing everything from having those conversations with local healthcare systems to actually looking at potential facilities that could be utilized if we need them.
Yeah, and also the Army Corps of Engineers has been actively working with our state committees and task forces, and they're being very, very helpful. It's been a good cooperative arrangement with the Army Corps of Engineers.
Thank you, Robert. Now to Molly Beck from Milwaukee Journal-Sentinel. Molly? And reminders.
Hi, thanks for...
Go ahead.
Thanks for taking this call. My question is for the governor. Governor, what do you need legislative action on immediately? The Senate leader said today that it could be a couple weeks before legislation is taken up. What do you need action on before then?
Well, as I said, we're briefing legislative offices regularly on the needs. We've had each agency respond in a fashion to look at what their needs are, and so we're putting it together, but we have to get buy-in, frankly, and there's extraordinary needs. The Department of Health Services needs to have the ability to have more flexibility in how they can respond. We need legislative assistance in that area. And so to put it bluntly, we're hopeful that we're going to make a good case, that they'll come into session as soon as possible. But we're briefing them on a regular basis, and we'll have a package available to them when they decide to come into session.
Thanks, Molly. Now to Olivia Richardson from Milwaukee Public Radio. Olivia? Milwaukee Public Radio? Okay, we're going to move on then to Jeremy from Urban Milwaukee. Jeremy?
Hi, I'm curious if there is a plan to release hospitalization data at any point, and if that's even a figure the state has aggregated.
Thanks, Jeremy. We actually, as Dr. Westergaard has noted a few times, we are working very actively to clean up that data. It comes from a variety of sources, and oftentimes when somebody tests positive, they aren't in the hospital, and that happens a few days later. And so how we reconcile that and chase those different data points so that we are able to accurately tell you in a non-duplicated way, that kind of information is on the top of our list of data elements, data pieces to clean up and be able to provide. I would tell you, based on our sources right now and our efforts that are currently underway, we are tracking at somewhere between 20 and 25% of folks who are COVID-19 positive, their test results are positive, are hospitalized. But again, we are urgently working to make sure that we have better visibility and more really are assured of the accuracy of the numbers that we're giving you. But that is what we're tracking right now.
And I would say that since we talked about this last week, the completeness of those data have gotten better. It was missing data about half of the time when we discussed it last week. Most recently, we're up to about 75% of the time. So as we get more confident that we're not don't have numbers that are imprecise, we'll be planning on posting that publicly. The Center for the federal government has also requested, as of yesterday, through a memo to hospitals to report this data voluntarily in more real time. So we'll have access to all of those data that are going to the federal government as well. So we'll have a lot clearer picture on that on a real-time basis, hopefully this week.
Thank you, Jeremy. Now to Mark Stevens from CBS 58. Mark? CBS 58.
Governor, do we expect the election to happen as planned?
Well, there's nothing has changed from my vantage point. We have several lawsuits occurring right now, and so it's part of state law. It's in state law. The date is set, and we're encouraging lots of people to vote absentee, get online, make that happen, and people are responding to that. So the answer to your question is yes, it's in place, but we also have, several lawsuits that is being challenged.
Thank you, Mark. Now to Angelica Sanchez from Fox 6 in Milwaukee. Angelica?
Good afternoon. The White House announced on Sunday they are recommending the public practice social distancing and other CDC guidelines until April 30th. Does this impact the length of Wisconsin's safer-at-home order, which was slated to end April 24th?
So our order was was a month, which is consistent with what the administration said on Sunday. I think we would certainly want to look at where we are in the days leading up to the expiration of our order, as we would do anyway, to see how successful we have been at bending the curve and protecting our healthcare workers in the system so that we have the beds we need to handle the surge that we expect. But with or without what we heard on Sunday, we would certainly and are continuing to assess our own efforts as we drive towards that April 24th date.
Okay, thank you, Angelica. Now to Rachel from TMJ4. Rachel? TMJ.
Good afternoon. Governor Evers, would you be in favor of a statewide order that shuts off water and power to non-essential businesses that aren't complying with safer at home?
I'd rather talk to them first and convince them to comply. It seems compliance should, I mean, at the national level, the president is following science and following the recommendations and advice of the science community and the public health community. The state level, we're doing the exact same thing. Now, if those that that are considered non-essential can't comply, I think I'd rather talk to them rather than shut something off. But at the end of the day, they're all good people, and we need to comply in order to keep our state in a safe place. That's the bottom line. And so I just encourage all those that are struggling around this issue to think about the importance of everybody working together. And if you're not complying, that ain't happening. And so please reconsider.
Thank you, Rachel. Now to Matt Sen from WISN in Milwaukee. Matt?
Governor, hello. Senator Johnson, in an op-ed today, suggested to identify non-essential businesses that should be closed, and instead of identifying essential businesses that should be open, if that makes sense. In essence, he just wanted to keep more people working. What are your thoughts on that, sir?
Our essential businesses, as I said when we made this first ruling, engage a broad swath of industry in the state of Wisconsin. If you think about the major industries that we have in the state and how important it is around our agricultural industry or our paper industry, other industries that are crucial to our state's success and having a strong economy, we're already there. So turning that on its head makes no sense to me. We're getting good cooperation from everybody.
Thank you, Matt. Now to Mariella from Wisconsin 38. Mariella?
Hello, thank you for that opportunity. Can you hear me?
Yes, we can.
Thank you so much. I have a few questions. This is a combo, and I know that it's not a lot of time, but there is a lot of concern in the low-income, the Latino, and the undocumented community. Question number one will be if they are having any access to free health care, free testing, in clinics and hospitals as well, free because they have no insurance. And then also if there is going to be any economic relief in the state for the undocumented. Another concern is why having employees being ordered to keep the employees' workplace safe for some companies who are endangering their employees by potentially exposing them to coronavirus. And my last question is, if your doctor has ordered to quarantine, when you apply for your employment, people are concerned about the questions if you are qualified to work, if you answer yes or no, do you refuse to work? Thank you so much.
So I'll take the first one, Mariella. Cost should not be a barrier to testing or to treatment, and both through our work at DHS, through the work that the Office of the Commissioner on Insurance has done in partnership with private sector insurance, folks are working hard together to ensure that cost is not a barrier to testing and treatment, and a number of companies have said publicly, have asserted publicly that they will cover tests and treatment. So I do think it's important for folks not to avoid needed care because they are uninsured. We need to make sure that folks who are having symptoms can call a clinic, can call a physician and get guidance about what they need to do to either to seek treatment or to get a test. And so I really do want to make sure that people hear clearly that cost should not be a barrier to access for needed health care as it relates to COVID-19. On some of the other questions, I think that there are other folks here.
Yeah, just speak to the issue of safety in the workplace. Those issues are with us in a COVID-19 environment or a non-COVID-19 environment. Our employers, and we have great employers in the state of Wisconsin, have to comply with federal and state laws regarding safety in the workplace. That is not any different now than it was before, and there's complaint procedures under both state and federal law to do investigations of that. And I just want to turn it over to Ryan just for a second on the unemployment insurance
Sure. So that was addressed with the emergency order number 7, addressed the eligibility for unemployment insurance as it relates to somebody who has COVID-19. And to follow up on what the governor said about employer safety, it is important that even employers who are essential businesses, the Safer at Home order does require them to implement social distancing and other practices to the greatest extent possible, just to address those concerns in terms of keeping people who have essential jobs, that they're still staying safe to the greatest extent possible.
And then the third question was about quarantine, and I'll take that because I think it's a good opportunity to review what that means exactly and how important it is. So the Safer at Home order is our biggest intervention that really affects the whole community, the whole state. Safer at Home means we want to reduce the number of people who come into contact so the virus doesn't spread as much without us knowing it. But when we do identify individuals who have coronavirus infection, quarantine and isolation, those are the two biggest public health tools that we have to prevent small outbreaks from becoming big outbreaks. So isolation is what we say when someone is ill with COVID-19, we need to isolate them, we need to keep them safely separated from other people so they don't transmit the virus. What quarantine means is among people who have been exposed to someone with the disease but don't yet have any illness, we need them to remain physically separated from other people, so that in case they develop symptoms of the disease, or if they develop the illness without a lot of symptoms, they're not spreading it. So the important thing about quarantine is that, number one, it's for people who don't have symptoms but who have been exposed to a person. And the second is that it's not forever. So it's 2 weeks. That's the amount of time that we think is the period where someone who might become exposed to the virus would develop symptoms. So really, as we get into the specific cases where someone is a household member or someone been in close contact with in the workplace who's been exposed, quarantine is really the fundamental public health strategy to keep them separated from other people so then they don't spread to other people. So that's a good reminder of what our tools are at the local level when we do have cases.
Just one more thing about workplace, safe workplace practices. A number of healthcare folks as well as business leaders have prepared a list of safe workplace practices during this crisis. It's on the DHS website, and if there's any questions about what those are, I'd sure check that out, both if you're an employee and an employer.
Great. Thank you, Mariella. Now to Will Keneally from PBS Wisconsin. Will?
Hi. Well, thank you again for doing this. Governor, in the legislation that your office put forward over the weekend, there's a change to how public health emergencies were declared. I was hoping to get pick your brain a little bit about why you wanted that change, and also whether you had spoken with the legislature about possibly extending the current order.
Sure, I can answer that for the governor. Yeah, so that one of the things that the goals with the package was to make sure that state law reflects the current crisis that we're facing in the state. And so that's why there are a number of proposed changes to how emergencies are declared and also for the duration of those, because historically in the state, when there's been an emergency declaration, is to deal with a very isolated incident, dealing with a tornado or dealing with a severe snowstorm. Is a short time duration. The state can respond quickly, mostly through local authorities, and then with the state providing assistance in the back. This is an emergency unlike any other that we've had in this state's history and this nation's history, and so that it does require a different way to respond, both in terms of how locals respond and how the state responds.
Thank you, Will. Now to WXPR Radio in Rhinelander and Ben Meyer. Ben? Ben Meyer from WXPR. Okay, we're going to move on then to Matt Piper from the Sheboygan Press. Matt?
Yeah, this question is for Dr. Westergaard. I know that previously some people have mentioned the University of Washington study. I wondered if you could just tell us what your own personal reaction was to that, seeing it, and what some of your thoughts were, and how it compares to your own internal projections.
So our projections for the or forecasts for the numbers here that the Secretary has talked about are based on similar types of models, and I guess their reaction is that, you know, the story hasn't been written yet. We don't know how this is going to go, but the parameters in these models sort of tell us sort of the bounds: worst case scenario, best case scenario. What I'd say about the models that we used that led to the numbers of 22,000 cases, that was assuming a doubling time of between 3 and 4 days. And you could look at our numbers that say over the past 7 days, we've not doubled the number of cases. We're beating that a little bit. So I think the message and the reason for optimism is that the past 4 days we've not doubled the case numbers. So this is really going to be the critical week, and the most informative week to see how these things are going. My personal view is that we have already saved lives by doing safer at home, because the number of cases that we have not doubled in the past 2 days. We're seeing a slower curve. We don't know you don't know what the epidemic curve looks like until this is all over. But right in the middle of it, it could be a lot worse. And I'm convinced that the interventions we've taken so far have led to fewer transmission events than would have happened otherwise. So I think that's probably the most important message, is that what we're doing is working. We know it will be much worse if we would have carried on as usual. We really need to double down this week and next week. All the projections say, whether it peaks in 2 weeks or in 3 weeks or 4 weeks, the safety, that the interventions that we can do right during this week and also last week and also next week are going to determine what the curve looks like. So that's I think the most important message that we in public health want to make, is that we get to determine by how well we do social distancing what the curve looks like when this is all over.
Thank you, Matt.
Thank you.
Now to Anthony DeBruzzi from Spectrum News 1. Anthony?
Good afternoon. I'd like to go back to this public-private partnership that we've been discussing today. How will this really impact the ability of people to get tested? With more testing being done, are we ever going to get to a point where someone could be tested without a doctor's order? And if so, any insight as to when that could happen?
So I do think, and I'll let Dr. Westergaard talk about this a little more, right? We do want to make testing a little more widely available, certainly. We have been prioritizing so that we are making sure we're doing what we need to clinically for those who are at risk for most severe disease. But we do need to have some more capacity in the system to do the kind of surveillance we want to do, so that we really understand the status of the epidemic here in Wisconsin. We certainly are not at a point where we would recommend testing for everyone or testing without having a conversation and getting a doctor's order. But Dr. Westergaard may have more specifics about.
Yeah, I don't see us getting away from wanting to have the COVID-19 testing as part of a medical evaluation, because the symptoms that people have with COVID-19 can be a number of other things. And so the responsible thing to do, the best care, is to get an evaluation, make sure that it's not something else, and when it serves the patient's best interest, to order a test. So our hope is that testing for COVID-19 becomes a lot more widespread, but it would be, what that means is that it would look more like we test for influenza. So we don't drive through and get an influenza test. We try to get people to drive through and get an influenza vaccine. But the test itself is part of an evaluation to say, well, what are the cause of my symptoms? And so that's, I think, the hope, is that we can scale up COVID-19 testing so that when people get evaluated for symptoms, we can know whether people have this infection versus something else. And there's probably never going to be a role for testing asymptomatic people, meaning someone who just wants to know whether they have the virus with maybe very rare exceptions in the setting of an outbreak or a research or a public health investigation. So I think for the time being, we want there to be no barriers to getting tests when it's useful, but when tests are needed and useful is still going to be in the setting of really making a diagnosis in someone that has symptoms.
Thank you, Anthony. Now to Debbie Foss from Trempealeau County Times. Debbie? Debbie Foss? Okay, we'll move on then to Jessica Van Egren from Up North News. Jessica?
Hey, thanks for taking my question. I had one follow-up question in regards to legislative action for Governor Evers. You had talked about, touching base with each of your agencies and asking them what they absolutely need, and that when the legislature is potentially ready to meet again, that you hope to have a package available for them. Are you thinking that at some point there's going to be the package that you put together and then something completely different that Republicans are putting together? And do you see that as problematic as far as the time it could take to work out those differences and get something passed?
Anything can happen. And I would say that given the circumstances of this virus and the seriousness of it, and frankly the seriousness that the people of Wisconsin are taking around it, I feel confident that if there are different ideas, we'll be able to work it out.
Thank you, Jessica. Now to Mason Dowling from WAOW in Wausau. Mason? Mason from WAOW? Okay, we'll move on then to Stephanie Hoff from West Politics. Stephanie?
Hi, I'm wondering if you guys are keeping track of who's been recovered from COVID-19 and why or why not you're tracking that.
Yeah, I can answer that question. It's a good one. We've discussed this a couple times in the recent briefings. So our hope is that everyone recovers with this infection. Unfortunately, when we look at the large population, between 1% and 2% don't. 1% to 2% of people pass away from this infection. But the infection itself, in the majority of people, is self-limited, and people fully recover. Now, we don't have good systems to identify when a person is cleared from the infection because the reports we get are about diagnoses and hospitalizations. So if we reported when people recovered, it would be a guess based on how much time people have been infected, and I don't think that would be very, very accurate or very reliable. So our focus is on measuring and reporting bad outcomes, meaning deaths and hospitalizations, with the understanding that the majority of people are going to fully recover within a week or two. So that's why we're not reporting it, just because the risk would be that it would be misleading, because we don't have a great way to capture that accurately, and we really want to present facts and accurate information.
Thank you, Stephanie. Now to Shemaine Mills from Wisconsin Public Radio. Shemaine?
Hi, thanks for the Q&A. My question has been partially answered by Dr. Westergaard, but I'm wondering, in a previous call, Secretary Palm said we had 620 ventilators. Is that still true, and do we have projections on how many we might need?
Yeah, Charmaine, I appreciate you asking that. Sort of like this hospitalization data that we're working on our data sources and with our partners to enhance that and make sure that it is more and more accurate. The same applies to ventilators, and so while the information we had available to us through the system, the data system that we had said 620, I can tell you now that system is telling me that we have 1,215 ventilators, and that is because hospitals are in more real time reporting that information to us so that we have a more accurate picture of what is truth around the state of Wisconsin. And they continue, with everything else that's going on, they continue to improve their reporting of the number of ventilators that exist in hospitals around the state of Wisconsin.
Thank you, Shemaine. Now to Bob Haig at Wisconsin Radio Network. Bob? All right, we'll move on then to Gwen Ginther from the Wheeler Report. Gwen?
Yes, I just want to verify some stats. Wisconsin has approximately 11,000 beds and about 2,400 ICU beds. And normally we operate at about a 58% capacity. Can you tell me in general, do you have any idea what capacity we're at right now? And you said approximately 20 to 25% of those who have tested positive are in the hospital. So we have approximately 250 people in the hospital right now that are positive.
So I think capacity rate is, or current, the 58% is occupancy across the board. And so I think it is important for people to remember that while there are 20 to 25% of our COVID patients are currently hospitalized, that is only a portion of the number of people in the hospital, right? Folks are going to continue to have babies. There are going to continue to be heart attacks and strokes, et cetera. And so that's part of why flattening the curve and doing social distancing really well is important, because the rest of the stuff that's happening to us in healthcare will continue to happen. The emergency stuff, the non-essential stuff, most hospitals are starting or already have moved that business out of the hospital so that they have the capacity that they need. And so we are continuing, as I said, to improve the data that we have around occupancy in hospitals, around the percentage of that is COVID-19 capacity, and feeding that into our surge planning so that we are better able to predict and understand what we might need in the state of Wisconsin to ensure that we have enough bed capacity when the surge comes.
Thank you, Gwen. And our final question this afternoon goes to Eric Gunn from Wisconsin Examiner. Eric?
Hi, thank you for taking this question. What instructions, I guess, Ms. Palm, this would go to you, but whoever is able to answer this, what instructions are going to hospitals about triage criteria, and specifically about the treatment of, or the consideration of people with disabilities or with certain conditions as to be more likely or less likely to be classified as do not resuscitate, or to get or preferential or deferred treatment based on those kinds of criteria?
So from a health equity perspective, we obviously want to ensure that those kind of factors do not disadvantage someone from the care that they need in this response. And I think it speaks so fundamentally to doing Safer at Home well, so that we don't face, so that individual hospitals, individual doctors don't face those kind of decisions. But fundamentally, we need to protect folks with disabilities, folks with underlying health conditions, folks with other factors that may that should not be considered when you're making those kind of decisions moving forward. But our goal, obviously, is to prepare for the worst and hope for the best. And so social distancing, Safer at Home, those things that we're doing, as Dr. Westergaard mentioned, and need to do really well over the next couple of weeks will matter as we continue to face what we need to do to be prepared for the surge.
Yeah, and as far as that issue, it's our most important goal, is that people stay at home so we're not in that predicament. But also, it's our goal to make sure that we have enough resources available, and that's what we're spending a lot of our time at the state government, is make sure we have those resources available so that they aren't scarce, so those difficult decisions don't have to be made.
And thank you. That concludes today's media briefing. Any additional questions from the media can be directed to DHS Media at dhs.wisconsin.gov, or you can call 608-266-1683. A reminder to continue to monitor the DHS COVID-19 webpage, as well as the Outbreaks and Investigations page for data and guidance materials. For answers to questions concerning the virus response not related to public health, Please visit the websites of the Governor, the Wisconsin Economic Development Corporation, the Department of Workforce Development, Wisconsin Emergency Management, and other relevant state agencies. Thank you and have a good afternoon.